somebody asks me, what do I do for a living? I have to tell them about Roanoke Valley to start off with. Roanoke Valley has a lot of resources. And the thing about it is, people don't know about all these resources. So what I do as a community health worker, I connect them to these resources. I'm like a GPS for them. So I say, if they need housing, I say, well, you can go here. They need food, or something like that, so you can go here. You need social services, you can go here. There's like I said, Roanoke is resource rich, but the word doesn't get out like it should.
Right now, I'm still working with him, but we started to work together in December. It's April now, but the gentleman was just in need of a cane. That's how it started. And we met twice in the same day, like coincidentally, and so we spoke and helped get him a cane, and then it just kind of went from there. He had a lot of needs, being able to get his medications regularly, getting a primary care doctor. He needed to apply for disability, and he needs sustainable housing as well. He worked up until he couldn't work any longer, though. He told me he had people within his company lifting him up off the ground with a machine to get into a forklift. So he was really trying, so I really admired that. But he worked till he could not anymore, and he just needed some guidance and assistance.
Part of our criteria is that they have to have at least 2 visits to the ER. So, and the reason for that is because sometimes people use the ER as their primary care, and that bogs down the emergency room with things like colds and stuff. That's not really an emergency. So, the thing we try to do also is change their mindset. So I had a client who I met at the clinic, and she had several ER visits. So I talked to her about it, and said, why? She said, well, if I get sick, I just go to the ER. I told her about where I work at, the New Horizon. I told her about the benefits we have here. We have like after hours nurse helpline. She didn't know about that. I said, instead of first thing going to the emergency room, call our helpline and see if they can get you in the next day or something like that. No, they advise you, is that really an emergency room visit? So next week, she did call our helpline, and then she came in the next day. So it changed her mindset, and that's a good thing, because you don't want to have all these people in the ER for stuffy nose.
I don't have any stories about patients that are stuck with me. My stories are more about the dedication to the work. My story is about the dedication that I've seen that the CHWs have placed in their ability to work with this target population. Often healthcare outcomes are not something that's visual. There are not a lot of statistics and data about healthcare outcomes. Well, there is, but not actually where you can see it in the life of a person. When I deal with the CHWs, I have the opportunity to see it in their lives and experience it through them. And it's only because of their dedication and their hard work that I feel thrilled to truly be a part of the hub. And I can acknowledge that there's some great work that's going on right now. That's about my story.